Good afternoon, everyone. Thank you for joining today. My name is Claire Paprocki, and I am the Public Information Officer for Brown County Public Health. Before we start today, it's my pleasure to share with you that we have two guests joining us today. We have Brown County Executive Troy Streckenbach, who has an update regarding community testing. And we have Lori Radke joining us, who is the President and CEO of the Greater Green Bay Chamber of Commerce. She's going to talk about what the Chamber is doing to help our local businesses as they look towards reopening. We are recording this also, and we'll send it out to everyone after we're done today. I will start out with the numbers. So today, Brown County is reporting out 1,959 confirmed cases. United Nation is reporting out 22. We currently have 42 individuals who are hospitalized. And we are reporting 347 individuals who are out of isolation. Unfortunately, I do have to report that we have another additional 2 deaths to report today. That brings our total to 20 deaths in the county. The first one is a 85-year-old male from the zip code 54162. The second one is a 65-year-old male from the zip code 54304. Yesterday at the Resch Center, we were able to test 489 individuals. At Casa Alba, we were able to test 375 individuals. Since we began the community testing sites, we have tested 4,185 individuals between the two. I will now turn it over to County Executive Troy Streckenbach for an update on the 2 testing sites.
Thank you, Claire. I appreciate the update on the numbers, and it's encouraging to see that the 2 community test sites are in fact increasing the numbers of total tests that are being conducted at those locations. Obviously, the state's ability and willingness to allow us to test essential workers, I think it was helpful for us to have some stronger numbers out of those 2 community test sites. As we've talked over the last several weeks, we've continuously talked about the importance of testing. Over the course of last week and even yesterday, we talked about in order for us to reopen and get back as an economy, new normalcy, testing is going to be a critical piece of us to be able to identify, isolate, quarantine, and educate. And so from that perspective, we've always had the goal of essentially testing the community. And in a perfect world, it would have been always asymptomatic community testing. And as we all know that nationally, in the beginning stages, when it started to reach our shores, this virus, we all knew that the resources, the testing kits, the ability for us to do the test was not widely available. And so both the national and state governments were essentially prioritizing those testings to certain areas. As Brown County in the early parts of April started to realize, or latter parts of April, realized that we had an outbreak taking place in our community, we made the request to the state for assistance. The state did provide both the National Guard, as you're seeing in this clip, at one of the community test sites. But in the early stages, that was mainly for the outbreak with some of the businesses and the family members and the workers at those locations. And over time, the state has allowed us to expand that testing for more and more individuals. So I'm really pleased today. We finally hit the milestone that here in Brown County back in the earlier part of March when we first built our first community test site. I'm happy to announce that we've been authorized and are able to extend the community test sites through May 22nd. We will be able to test now all Brown County residents regardless of whether or not they have symptoms or they don't have symptoms. So asymptomatic Brown County residents can now get tested at either one of the 2 community test sites. And the extension of those community test sites are now, originally we were going to be transitioning to the healthcare providers as 17th of May. We've actually extended that now to May 22nd for those 2 community test sites to operate. Again, as I've stated in the past, the collaboration and support that we receive from our healthcare providers here in Brown County, Aurora, Belen, and Prevea, have been outstanding in terms of team players, helping us manage these sites. Additionally, of course, as you saw in the clips, the state authorizing the National Guard to come down and help us with these sites has been instrumental. And in addition to that, the overall community support, whether it's United Way with 211, all those aspects have been critical for us to have this community test site. So I just wanted to keep reiterating, now at this point, we've been asking for these community test sites. We've been asking for the asymptomatic community test site or testing to take place. We now have it for an additional 10 days. I would encourage everyone to go out and get tested and allow us to be able to do that contact tracing, the isolation, the quarantining, because what we're going to be discussing next with our next guest, Lori Racky, who is the president and CEO of our Greater Green Bay Chamber, really for us to be able to bring our economy back, which, today I saw on social media, just a really sad story of a small business that's been in business for over 10 years, had to close shop because they are not able to make ends meet and they no longer have any money to support their business. And I think that's the devastating aspect of what this COVID, you have the deaths, of course, and then you have the economy. And 80% of our economy, as we know, is made up of small businesses, mom and pop stores, the blood, sweat, and tears that, someone takes that risk to, start a business. As we transition and start to look at reopening our economy, obviously there is the first and foremost request that myself, along with public health, will be making of the public. As you're going into businesses, make sure that they're doing the appropriate precautions to make their space as safe as possible for you to enter. Do us the favor and continue to wear that mask in public. This is not to protect you from getting the COVID. It's actually to for you to protect others from getting it from you. So that's the right thing to do at this point in time until we have better understanding of how this virus is in our community. And as we know, in order for businesses to reopen, the normal is not going to be what we knew of it prior to March. The new norm is going to be a little bit different. It's going to certainly be different until we have a vaccination, medication, better understanding of how antibodies work. And so in order for us to prepare for that, we've seen from the governor's office through WEDC the guidelines for industry. We've seen publications that are coming from associations, both at the state and national level. And then we have our local, really the boots on the ground, that trusted advice, trusted resource in terms of advice. And joining us today is Lori Racky, who is the president and CEO of the Greater Green Bay Chamber, who have put together a couple different programs that are going to be very useful for the business community here in the Greater Green Bay area to access and to reach out in terms of finding out information or perhaps a grant. And here to talk more about that is Lori Racky. Thank you, Lori.
Thank you, County Executive Streckenbach. Really pleased to be here and share with you the efforts that we have behind our businesses in our community. So as a chamber, we have about 1,200 members and over 80% are small business. And so we've put together programs specifically for small business, but we also have other programming really to meet the needs of all of our businesses. What County Executive Troy Streckenbach was referring to is within the last 2 weeks, we've launched 2 very special programs. One is the Greater Green Bay Back to Business Grant, and we're really excited about this opportunity. We've had some community leaders come together and fund a grant. We've raised over $250,000 that will be specifically granted to small businesses. So we opened up the first round and closed that application process last Thursday, and anxious in the next week or so to award those funds to small businesses to get them up to speed and help them stay in business, and their financial viability obviously is very important at this time, and we'll open up a second round to do that as well. And as recently as yesterday, we made a public announcement that we launched a small business resource hotline. And this really is just to be that one-stop shop. So if you have questions, you can call Monday through Friday, 10 to 3, and we have local experts and local businesses that have committed their resources to really provide that one-on-one consulting and help businesses get through this transition, how to reopen, what does it mean with the PPP program, and just a whole variety of things to really help folks sort through what their next steps are. It's open, or it's critical that they're able to open, but they have to find a way to coexist with COVID-19 in our community. And so what is that smart way to do that, to keep their employees safe, and certainly the customers or anybody patronizing their business when they come in. So, you know, those are specifically for small business, but really in the last 7 or 8 weeks, the Chamber's been really able to pivot and really embrace this virtual world that we're all living in. And we put together just a whole variety of virtual webinars to allow people to engage. We've provided information, resources, professional development, personal development, and really even guidance on how do you just live well in this virtual world that we're all experiencing. So hopefully that's helping employees stay connected and stay well as they're trying to figure out working from home and still being productive and balancing all those needs that they have. We have a ton of information on our website. We launched a job resource. There's a lot of companies looking for employees and employees looking for work, so we have that connectivity. And we also have some guidelines, as was mentioned earlier with the county executive. We have the OSHA guidelines out on our website and different phases and steps you need to put in reopening. WEDC has some specific guidelines as well. We also are hosting roundtables where we're bringing industry clusters together and they can share their own best practices. So really, you know, colleagues helping colleagues and sharing, hey, this is working, this isn't working, how are you addressing this? And so it's really that opportunity to really continue to connect and convene individuals with other individuals, but also with information. And so we're really happy to fulfill our mission just in pivoting in a different direction and really providing that connectivity and convening and being a resource for companies. So really proud of all the work that everybody's been doing as we try to navigate these uncharted waters right now. So I'm happy to be here and happy to continue to try to serve our business community. Thank you.
Great. Thank you, Lori. And as we know, you know, obviously there's this whole process that we're going through. There was originally the stay-at-home order and millions of different questions that were being asked about who's essential, who's non-essential, what's critical infrastructure. And then obviously that public health then kind of took over with the testing and monitoring, the isolation, quarantining. And always in the back was, what does the new norm look like? How are we going to continue to operate? What advice are we receiving? And I got to give the Chamber, both Lori and Kelly Armstrong, the VP of Economic Development for the Chamber, have really at the beginning, right as this started to reach out asking what can they do from their perspective. You know, and I would just say that, you know, they've been in constant contact with both the New North, the New Manufacturing Alliance, the state, you know, and just trying to make sure that they're providing the information. And as you heard Lori mention, they put on a number of different programs in this virtual world to make sure that people are still involved and engaged in answering the questions. And I can tell you, Lori, I'm sure that number is going to be ringing off the hook, because just as myself as a small business owner, I know that our staff are asking questions about, all right, what are the rules around the PPP? How can it be used? What's the forgivable? There's just a lot of questions I think a lot of small businesses are going to have, and it's great that you guys are putting together that team. So that team is made up of a number of different businesses right here. Wifley, I think, was one, Associated Bank. So you have actually experts that are going to be able to ask those questions that are right in the industry. So, well, you know, that I think that that's going to be a prize for small businesses to rely on, because we all heard the stories of trying to get unemployment right now in this current framework with the high volume. There are a lot of people who still haven't received their unemployment, and calling the state and not getting a human being to talk to has been somewhat frustrating. So I'm glad to hear that here at the local level, businesses will have a resource to go to. You know, so when we look at the whole bouncing back and the Badger bounce back plan, when we look at the guidelines that have been created by WEDC, we certainly hear from the small businesses. I think New North put out a original survey that stated that roughly 35% of the businesses wouldn't survive if this extended further, much further out into, I believe it was June. That's really concerning. And obviously, from a public health perspective, we want to make sure that we're able to get back in operating in business as best as possible. And so that advice between WEDC, the advice that the chambers are sharing, OSHA, CDC, public health, it's going to be critical for the business community to realize that when they do open up their doors, and of course there was a new order yesterday that allowed small retail shops to allow 5 or less in, it's really important for them to make sure that they're doing everything they can to make sure that when that customer does come in, that they're doing it in a manner that, one, builds confidence that coming into their store, they're going to be safe. But secondly, we don't have a repeat of a large outbreak in our community, because that will just set us back. And that will ultimately harm businesses more than it already has today. So thank you, Lori, and your team for really, helping us get to this point. And hopefully as the planning, the counties put together a Brown County planning guide that our health department, really from a licensure permitting process, we obviously have our documents that are available for the type of businesses that we have contact in or inspect. The county has certainly have moved to a virtual inspection. We've had a couple of restaurants that will open up early, but because we weren't able to do the on-site inspection, we actually transitioned to doing a virtual inspection. So now this restaurant has been able to open up and do at least delivery services and to-go orders. So from that standpoint, the county continues to work on trying to allow and work with businesses to open up, and we'll have those planning guides available for businesses. So make sure that your team, Lori, is aware of that. Obviously, we're going to be looking to what the WEDC is providing for those ultimate state guidelines. And let's hope that we can get in front of this curve, and with this increased testing and going back to the increased testing, the community-wide testing, the hours for these community tests will be the same, Monday through Friday, 8 a.m. to 6 p.m., Saturday, 10 a.m. to 3 p.m., and they will be closed on Sunday. Both sites will be operating until May 22nd, and again, that is for asymptomatic community testing. So anybody who wants to get a test, regardless if you have a symptom, you're happy to, we encourage you to go get that test. And at this point, Claire, I think I'm done with my remarks, and we'll turn it back over to you.
Thank you, County Executive. Before we open it up for question and answer, I do just want to let you know we're going to change our schedule for the briefings. So we will host these daily briefings until Thursday this week. On Friday, there will not be a briefing. We will send you out the numbers that we report daily. Next week, our briefings will be Monday and Wednesday. And every day that we do not have a briefing, so Tuesday, Thursday, Friday, we would email out the requested numbers the same way we would email out the invite. So I will now open it up for questions. Again, please announce your name and that outlet you're reporting from, and just let us know if you have a question for County Executive Troy, Lori Radke, or myself.
Doug Schneider from the Press Gazette. Just wanted you to go over the parameters for setting up an appointment. Does the testing run to the 22nd or through the 22nd? And basically, is there anything different in terms of scheduling an appointment as opposed to what's done there so far?
Yeah, Doug, testing runs through the 22nd. You can set up an appointment the same way. You can call 211 if you don't have access to internet or a smartphone or the computer, or if you do have access to a smartphone or the computer, you can go to stayhealthybc.com and choose your site. And we will continue testing as long as volume allows. And like County Executive Troy said, we are encouraging everyone in the community who feels like they need to be tested to go ahead and get tested.
Rob Sussman from WTAQ. Kind of a quick transition from only testing people with symptoms to testing essential workers regardless of status to now opening it up to everyone. How exactly kind of did we progress from the initial set to something that, a lot of people in the country haven't been able to do, which is test, just about anybody who wants it?
So I would say that, Rob, as you've seen over the course of the last month and a half, Brown County has been requesting this. It's unfortunate that we had to have an outbreak in order to get the testing. But I think this is an overall strategy. One of the things that we were originally communicating to both the state and the federal government was, at some point in time, we have to get back to normalcy. We have to get our economies back starting. And we understand that testing is going to be one of the critical aspects. What we saw with the states of Utah, Utah, Massachusetts, and Nevada, I believe it were. I'm not sure about the third one. They were really working with their private sector locally, trying to figure out how they could, source and supply chain the testing capabilities, because they all understood that in order for their economies to come back, they're going to have to be able to understand where the coronavirus was. And so we've been kind of communicating that for a long time. As the resources became more available and as the testing capabilities came online and the labs were able to be able to handle the increased capacity, is when essentially a county like Brown was able to get the additional resources. And so from that standpoint, it started off with, as you saw, the transition, severe symptomatic only. And then over time, they've, loosened that up. As you saw, we announced on Saturday that they were, we were being okay to allow for essential workers who were asymptomatic. So over time, as the supply chain, the increased testing capabilities and the capacity for the labs all have increased, that allowed us to actually do the increased testing to where we are today.
And just a quick follow-up, and I may have missed this. This may have been something you said. The full-on community testing where anybody can come in, is that starting today?
So that actually starts tomorrow morning. And just, I didn't mention this before, and I'm not sure if Claire mentioned it, but keep in mind, again, that as of right now, through the community test sites, these are all free to the public.
Mackenzie Amundsen, WBAY for County Executive Struckenbach. Can you talk a little bit more about that virtual inspection? I don't know if you have specifics or you're able to identify the restaurant or how that process worked. I'm just kind of curious about what that looked like.
Well, I think public health would probably be the better one to answer this question, ideally a sanitarian. But what I understand is that that we've had a couple of establishments who were kind of caught in the midst of a period of, opening up. They've purchased a location, they did their renovation, and then all of a sudden the world kind of, COVID hit us. And obviously from a sanitarian and a deployment of our resources, we initially said, all right, public health, react, we're moving all of our staff and able bodies to address the COVID, the contact tracing, a number of, so the sanitarians that had normally we've been going out and inspecting locations, we actually reassigned them to help with the initial response to the COVID-19. As more staff were trained and we were able to reassign staff internally, we realized that at some point in time, we're going to reopen the county, and that our sanitarians whose main purpose in their role is, working with establishments and doing those inspections. Obviously, we had, a couple locations who were interested in opening up, and they were able to do a visual inspection virtually. How that was actually done, Mackenzie, I would refer back to and ask that a sanitarian reach out to you, or perhaps the business who's interested in, and I'm sure they would love the press, but I would just refer you to public health. And Claire, maybe if we can reach out to Mackenzie afterwards with the sanitarian, Ted Shove, and have him reach out to Mackenzie on that issue.
We do have Ted with us right now.
This is John Duran with WLUK. This is probably for the county executive. If my math's right, it says you administered 864 tests yesterday, which I believe is the closest you've gotten to that 900 tests a day between those two sites since you opened community testing. I'm assuming that has a lot to do with opening it up to asymptomatic essential workers. But moving forward, does that goal change now that you're opening it up to a potentially much bigger pool of people? I mean, do you think you do more than 900? And secondly, I mean, do you think you'd still have the manpower with those two sites to administer potentially a lot more tests, or are you maybe thinking of opening, I don't know, another site or adding more people?
Well, seeing today we're talking about reopening, I think every business always wants to have the fact that we have so much business that we have to figure out how to expand. That said, right now, I think the RESH Center was at actually around 500 tests conducted yesterday. Originally, we thought the capacity was 450. They were able to do an additional amount. So what I would think, or what my guess is, that the incident command or the unified command will continue to monitor the locations and see what the demand is like, and then make adjustments thereafter. If we continue to see these high turnouts in excess of 900, I'm sure the conversation will switch to the healthcare providers who have established some of these other community test sites that have the capability of managing around 200 a day. We would probably then look to see if they were able to open up. Eventually, that is our next goal, is by the 23rd, is to then transition to these community test sites, or these healthcare provider test sites that have been established. And but you know what? Based on the demand and the numbers that are coming, I think we'll evolve based on that.
And just a quick follow-up on that too. We saw that that May 16th date get extended. Does the May 22nd date have the potential to extend, these community test sites extend, or is that when you kind of would like to see it end, or is that a set in stone date that can't get extended?
Well, I think our goal right now as public health and as a county is that we would transition to our healthcare providers, who ultimately they are the ones who are best to manage this. They're the ones who are, are authorizing the test in the first place. They're the ones who are making the initial contact to the resident who received the test to let them know of the results. And of course, then public health comes in to do the contact tracing. So it is actually better to be in our perspective, it's better for this to actually be taking place with the healthcare providers. But right now, because of this recent news and with the fact that we are able to increase the testing of the community asymptomatic, we've made the request to the state to allow for these sites to remain open, both the Resch and the Casa Alba location to be open for another week. But it is our goal to have these sites transition by the 22nd over to the healthcare providers.
For Lori Radke, this is Nate Phelps from Spectrum News. If my colleagues will indulge me, I have a two-part question for you. First question being, what does Brown County's business environment, particularly from the retail side, look like as we come out of this? Have businesses gone? Are they going to be gone? Or is it going to come back like it was in March? What's your feeling and what's the reality on the ground right now?
Well, that's the ultimate question, right? Are they going to be able to open up and have the same type of economic impact and cash flow that they had prior? And so I think our goal is to make sure they can open up safely, and so the consumers feel confident to go into the retail space and begin purchasing and participating in the retail activity. So quite a few large retailers obviously were able to stay open. So really focusing right now on the small retails that just got the green light and how we can help them open up and then communicate that they're open and then be able to articulate the steps that they're following to maintain that safe environment for their employees as well as the people coming into their shop.
Gotcha. Lori, second part of that is, do you get a sense that women, minority, and veteran-owned businesses, did they fare any better or any worse through this? Was it more difficult for those businesses, or are you seeing any issues there, or are they in the same boat with everyone else?
I believe they're in the same boat with everybody else. I think that their economic hardships were the same, and certainly we're here to support them, whether it's through the grant process or the one-stop shop and the hotline they can call. And there's other resources as well in the community, and hopefully we're able to connect that and really rally around these small businesses and make sure that they're able to maintain their viability and keep their doors open. That would be our goal.
So just so you know, Nathan, the governor did announce that there was a grant specifically designated for minorities and ethnic groups. One of the things that we've been communicating to the state was that Milwaukee and Dane County both received directly from the CARES Act a significant amount of money. Dane County, roughly $95 million. They actually took, of that 95 million, they took 10 million and actually created a loan fund available to small businesses. And as you saw in our community, the great willingness of, the small businesses, the city of Green Bay created their platform, the Greater Green Bay Chamber through some area businesses created their platform. And then you saw what the Green Bay Packers did for the nonprofits. But, a $10 million loan program or a grant program that we could have available for businesses up here in Northeast Wisconsin or in Brown County. Keep in mind, we represent the third largest economy in the state of Wisconsin, yet the economic development tools that were provided to other parts of the state, mainly Milwaukee and Dane counties, are not being, similar up here. And that's not because of the state of Wisconsin making that decision. This was just purely based on the fact that, both Dane and Milwaukee County have populations over 500,000, which allows them to directly receive the CARES Act dollars. What we're asking the state is to recognize that Brown County is being the third largest economy in the state and the fourth largest county in the state, that we serve a much wider population in terms of the region, and to give us some consideration for allowing us to build or put together a similar program to help our businesses in Northeast Wisconsin, survive this COVID-19 virus.
Any other questions for Lori, County Executive, or myself?
Yeah, Jonathan Sadowski with Up North News. I just have one. That is, now that case growth has really been slowing, is it, how's the county feeling about your guys' position moving forward with the pandemic? And obviously now there are talks of reopening and stuff now that we're not that far out from the governor's order ending. So what's the county feeling right now?
So Jonathan, that's a good question. I have often been asked by another reporter, grade yourself, in terms of the response and where we're at. I would say this, my big question and not question, I guess, my big request of the public is, and the businesses, realize that this virus is very transmittable. It impacts disproportionately the vulnerable populations who are in in urban density places. And all I would say is that it's really important for us as a community, if we want to continue to see this downward trajectory and the ability for us to get back to some level of normalcy to allow our economy to get back up and running, two things need to happen. One, the public needs to continue to adhere to the advice of public health, CDC and DHS in terms of their ongoing interactions with the public outside of their own homes by wearing the mask, keeping that social distancing as best as possible. Same time as we're talking about reopening businesses and creating planning guides, it's also important for businesses to recognize that if we want to end this and get back to some level of normalcy, they own this to a degree as themselves as well. And that is creating an environment that both protects their employees and protects the customers. And so collectively, I think our goal is for us to continue to see this downward trajectory because our community is taking all precautions, both from a business perspective and a community perspective, to allow us to get through this.
My question is for the chamber. Can you provide probably the exact phone number or website that we might be able to refer some small business people to?
Absolutely. Be happy to do that. So you can go to the startuphub.org, and that would take you right to the hotline website. And that'll also take you right to the grant opportunity. The application's right online, and there's a full description of criteria for the grant application. So it's a 2-for-1 if you just go to that website. Otherwise, you can just go to the Greater Green Bay Chamber website, and we have links that would direct you there. And we could also direct you to our COVID website, which would give you the guidelines for businesses to reopen, whether it's from WDC or from OSHA or other resources that we've been able to pull together. Hopefully that's helpful.
Couple logistical questions. Are we cutting off the age of people who should get tested, or is it open to literally everyone? And are we encouraging people to get this test, or are we just saying, hey, it's here if you want it, be your own, make your own decision on that?
So I would ask Claire to clarify on the age, but I believe it was anybody over the age of 5, but that may have changed, and I'm not completely briefed on that. In terms of the second part of your question, Doug, I would just encourage anybody that was interested in learning right now. And again, we all have to understand that this is just a moment in time. This doesn't create a I'm safe going forward. It gives you the ability to know. But it also gives our county the ability to find out how prevalent it is. It gives us our ability for our contact tracers to isolate, educate, and quarantine. And it just reinforces the ability for us to educate the public about how important it is right now in this early stages, especially as the economies are, our economies are going to reopen here in the near future, how important it is for us to understand how this virus is transmitted. And the number one defense is us. It's simple as that. We are the number one defense at this point. And so the precautionary measures that we take will help us, limit the spread. And so right now, I'd suggest that if right now it's free, it's available, take advantage of it. We've been asking for it. I was glad to see that our numbers are up closer to the 900 capacity. And ultimately, I'd love to see the next 10 days at capacity. And ultimately, that would be a great goal. Claire, do you have any clarifications regarding the age?
So all ages are able to be tested, Doug. The confusion came, the National Guard is not able to test anybody under the age of 5. However, that's why we have our healthcare partners, Aurora Bellin and Prevea on site as well. They are able to test those who are under the age of 5.
Thanks for clearing that up.
Any other questions for us today? All right, thank you for joining. We will see you guys tomorrow.
Thank you.